Hi, I'm Dr. Andy Evans, Deputy Director for Clinical Services at the Rutgers Cancer Institute and Medical Director and Oncology Lead for the RWJBarnabas Health Oncology Service Line. And we're really happy to be here at ASCO 2024, and it's great to be here with Dr. Mridula George, one of our outstanding junior investigators at the Cancer Institute. And she's had a pretty busy meeting, and I want to ask you about at least one project that I think you presented yesterday. It was looking at ctDNA in early stage breast cancer. Could you tell us a little bit about that?
Yeah, so this was an institutional study that we did at the Rutgers Cancer Institute in partnership with RWJBarnabas Health and other community networks that we're affiliated with. And this was a study looking at patients with stage 2 or 3 triple negative breast cancer and HER2 positive breast cancer. So we wanted to see what is the role of ctDNA in identifying how we can guide treatment decisions in these patients with early stage breast cancer. So we looked at 30 patients who had detectable ctDNA at the time of diagnosis before they started any treatment. And we followed the ctDNA while they received neoadjuvant therapy and even post-surgery. There was a lot of correlation between pathologic response and ctDNA clearance in these patients. We also saw some interesting cases where patients had complete pathologic response as a result of neoadjuvant therapy, but they still had circulating tumor DNA that was detected. And these are the patients who are at increased risk of recurrence. As part of the study, we intervened and we saw that early intervention resulted in early clearance of ctDNA, and patients are doing well with no evidence of metastatic disease. But unfortunately, there are also cases where we intervened, but we were not able to clear ctDNA, and those patients did recur with metastatic disease. So this is an area of interest that we're looking at. We're trying to come up with interventional studies looking at ctDNA in early stage breast cancer setting and also in the post-adjuvant setting as well.
And that's exciting because I know this was an investigator-initiated project, A.
Correct.
And B, it involved our entire oncology service line.
Correct.
So getting this novel, cutting-edge diagnostic, prognostic, and maybe predictive biomarker out to the patients in the community.
Correct.
That's fantastic.
Yeah, and patients were very excited to be part of the study because this is novel, gives them more information about their cancer as opposed to waiting for an imaging or the results from their surgery. So we know that ctDNA is going to be the future of cancer care for breast cancer, and we're excited to be part of these early clinical trials.
That's great. And I also want to congratulate you on a recent award you received from the NCI as part of our NCI Comprehensive Cancer Center CCSG grant as a young investigator. So
yes,
congratulations on that. It's really
you.
Exciting. That's very competitive. And as part of that, could you tell me maybe about another project you're involved with? I believe you have an interest in survivorship, cardiac surveillance with statins. Could you maybe a little snippet about that?
Sure. So this is another investigator-initiated study that we're doing in partnership with our affiliate sites. We're looking at the role of statins, specifically Lipitor, in trying to reduce the risk of cardiotoxicity associated with HER2-targeted therapy. So that study is enrolling patients. We are almost 70% enrolled for that study, and the early data looks promising, so we'll continue enrolling, and hopefully that will result in a larger multi-site study in the future.
That's fantastic. And obviously diagnosing and treating cancer care with the most advanced treatments is important, but actually the survivorship is also as important. Make sure we're curing and avoiding post-acute and long-term side effects.
Correct.
So that's just fantastic work, and hope you have a great finish to the meeting.
Thank you, Dr. Evans.
All right.